The Oregon Public Health Report on wireless radiation in health is a sham. It does not do an adequate job of covering all the relevant data. For example, it ignores thousands of experimental studies. It does not take into account the growing experimental literature, including the study from the US government's National Toxicology Program, which was requested by the FDA, approved by the FDA, and ultimately issued in 2018 with unprecedented levels of review. That NTP study showed clearly that there was clear evidence that low levels of radiofrequency radiation, like those from cell phones today, can cause cancer in animals. And we know every agent that we know for certain causes cancer in humans will produce it in animals when adequately tested. So the Oregon Public Health Commission excluded the experimental literature, which is the bedrock for evaluating the potential of any agent to cause damage to humans. What they did instead was to take a very narrow look at epidemiological studies on humans. And in that regard, what they said is, we look at all of the studies, including those sponsored by industry, and we find that the evidence is not sufficiently strong. By saying that we don't have enough proof of human harm yet, what the state of Oregon is basically doing is experimenting on our children and our grandchildren for decades to come. And it's a betrayal of public health. What public health is supposed to do is prevent harm. When public health works, people don't die, they don't get sick. That's the challenge we face right now with the pandemic, because we're trying to figure this out in the midst of a huge challenge to public health. So we at Environmental Health Trust have provided detailed information about what's wrong with the public health report from the state of Oregon, and we urge the governor to retract this report because it's going to be damaging health of children and the rest of us for years to come. As the former founding director of the Board on Environmental Studies and Toxicology at the U.S. National Academy of Sciences, I can tell you that this government report from Oregon would never have passed publication and peer review at the National Academy of Sciences. As someone who's been an editor of numerous special issues of peer-reviewed journals, I can tell you this report would never pass peer review. It's a highly selective, skewed analysis of a limited amount of literature that includes biased studies funded by industry. And we know that those industry-funded studies tend to find no problem. We know that from the pioneering work that was done by Henry Lai, who for more than 4 decades has been charting work in this field and has shown consistently that sponsorship of studies influences the outcome of results. And when you look at independent studies, you find that independently funded studies consistently find a problem, and those funded by industry do not. This is a very important indictment of this report, an appalling failure to apply the duties to protect and prevent harm rather than to prove it's already happened. Recently, an international consortium of epidemiologists issued a strong statement urging epidemiologists to avoid conflict of interest and to declare when they have been sponsored by industry for their research. And they are deeply concerned about the growing conflicts of interest that are characterizing groups such as the International Commission on Non-Ionizing Radiation Protection, which is a self-appointed, self-monitored group of a small number of people that report to no government and has no independent oversight. These are examples where we've got to do a better job of declaring where people are coming from so that the citizens who look at this information will understand that there are conflicts of interest that have underpinned a lot of the advice, particularly those that tell us, don't worry, everything is fine. When it comes to independent review, you have to look at what Environmental Health Trust has to say. You have to look at the work of Leonard Hardell and Joel Moskowitz and many others, because if you want to know what's going on, you must ask, where did the person come from? Who bought their chair? Where do they stand? Because often where a person stands on an issue depends on where they sit and who paid for the things they're sitting on. And that is something that we have to do a better job of understanding more broadly. Probably the most important thing I did, I was involved as a young scientist
in the committee that actually reviewed the data and recommended that there be no smoking on airplanes. You may be shocked to hear that it was even a question for science at the time, but it was. And when I look at what we know now about mobile phone radiation, I see some very interesting similarities.
A growing number of prominent doctors and scientists are raising warning flags over radiation this morning, and your kids could be facing a greater risk of exposure.
I think the most important study is a study by the National Toxicology Program in a classic large carcinogenicity test, one of the largest ever performed, and for that matter, one of the most expensive. They found increased risk of the tumours which we believe radiofrequency radiation is causing in man. Particular tumours called schwannomas. In the rats, they were in the heart. In humans, they're often in the nerve, the ear nerve, the vestibular nerve.
Cell phone providers say they follow all safety guidelines put into place by the FCC. The current FCC safety standard was developed nearly 20 years ago.
The manufacturers actually tell people in the instruction manual, which I never read, not to put the cell phone against your ear.
It does say exactly that. There's the BlackBerry, for example, warns to keep your phone at least 0.98 inches away from the body when transmitting. With an iPhone, for example, it's 5/8 of an inch.
At this point, the evidence has become sufficiently strong that cell phone radiation is a human carcinogen.
A major development from California's Department of Public Health. High use of cell phones may be linked to certain types of cancer and other health effects, including brain cancer and tumors, lower sperm counts, headaches, and effects on learning, memory, hearing, behavior, and sleep.
If it was a real problem, I would know. If it was a real problem, the government would protect us. How come I'm not hearing about this? They're all things I've heard when I give seminars. You know, I get up there and they say, oh yeah, if this was really a problem, they would have told us. I am they. I am a, legitimate scientist, and I am telling you.
Did you know that cell phone, the one in your pocket, emits radio frequency radiation, as long as your phone's turned on, even if you're not talking or texting?
The American Academy of Pediatrics in over a dozen countries recommends reducing children's exposure to wireless radiation.
When using a cell phone, I always keep it away from my body. I use speakerphone or a headset like this.
To stop microwave exposure, I put my phone on airplane mode and turn off Wi-Fi and Bluetooth function.
I hold the phone at a distance and make sure it's not touching my body.
Cell phones are not toys. Children's brains and bodies are still developing and are vulnerable to wireless radiation. Practice safe and responsible habits with yourself and your children.
When using the computer, I always try to make sure my connection is corded, not wireless.
Remember not to use your cell phone in the car. The phone works at higher power in metal surroundings and bounces around, increasing your family's radiation exposure.
For their safety.
For your safety.
Because children are more vulnerable.
Remind them.
Remind yourself.
To limit your microwave radiation exposures.